Now, and in health news here this midday, women are very careful, I should say, with their bodies during pregnancy. They are cautious about what they eat and what they do, or at least they should be. But being pregnant doesn't give you a free pass to be a couch potato. So Dr. Leanne Haddock, an OB/GYN with Baylor Scott and White Health, is joining us now. And some women tend to feel very fragile when they're pregnant, or in the case of my mother's generation, they were told not to exercise. So we've sort of come a long way here, right?
Mm-hmm. Oh, absolutely. It used to be if you have never started exercising, you shouldn't. But now we're saying if you haven't started exercising, do. Because the effects are so good. I mean, just like you and I exercising, it's great and it's good for pregnancy, pre-pregnancy, pregnancy, and after. You get benefits of weight stabilization, lower your blood pressure, psychological things. It's great for postpartum depression, less chances of having gestational diabetes. And there is some good thoughts that may actually help labor, shorten labor course.
But every woman's body is different,
absolutely,
right? And so how do you know when you've reached your limit, or what your limit is in terms of how much exercise you can tolerate or should tolerate?
Well, the first order of business is always check with your doctor, because you may have conditions in your pregnancy that aren't allowing good exercise. But the recommendations are all pregnant women should have moderate exercise, such as brisk walking or resistance training, at least 30 to 45 minutes, at least 4 to 5 days a week. But if a woman's been doing intense exercises and she's well trained, she can continue most things.
Okay.
That's what's good.
So are there any, I hate to generalize anything, but are there any general tips for any pregnant woman in terms of what they should not do?
That's a great, so this is exactly what I say. First order, talk with your doctor and make sure you're okay. These things you shouldn't do: no skydiving, no scuba diving, no horseback riding, no downhill ski, and no jumping on a trampoline. We throw that out all the time. Make sure you're doing cool rooms.
Those are I would say those are sports and recreation, not
those
exercise.
Are intense, but you'd be surprised. I still would say that, because that still is considered too.
Because they want an excuse to be able to do those things while they're pregnant?
Probably so. Yeah, probably so. But make sure you're not doing hot rooms, you know, hot yoga and things like that.
Okay.
You can be on your back for short times. That's one misconception. Now, everybody always asks me about heart rate. Here's the thing about heart rate. Don't worry about your heart rate. If you can speak while you're doing your exercise, your heart rate's good. And of course, hydrate, hydrate, hydrate.
One final question here. Are you sort of exercising for two? Is the baby during the period of development experiencing any benefits from your exercise?
Well, the benefits are the whole of our picture. A woman is in better health. She's got better blood pressure, which could affect the pregnancy, ultimately the baby. She may not develop gestational diabetes, which could affect the baby. So then
all of that affects the baby?
Yes, I'd like to say the baby's ready to come out and do full exercise when they come out, but saying that,
you're giving birth to an Olympic superstar if you exercise.
Not quite like that, but it is just overall good health, and that passes on to a healthier baby.